Hello, everybody. Welcome to our Master of Physical Therapy Indigenous Pathway info session. Today's date is October 24th, 2025, just because we update this information every year. So I just want to make sure we're all watching the right presentation. Um, Today, I have with me my colleagues Louie and Amy, but I'll start by introducing myself. So my name is Shannon Field. My pronouns are she, her, and I am Métis, Cree, and Swedish on my mom's side, and Irish and English on my dad's side. And I work at the department as the Indigenous Initiatives Manager. So I get to do all sorts of cool things like working on curriculum, doing outreach and recruitment, working on the Indigenous admissions pathway for the program, and all sorts of other things. So I'm really excited to be here today. Louis, do you want to go?
Yeah. Hi, my name is Louis Donald. I'm the admissions manager for the Department of Physical Therapy. I'm very happy to be joining you today for this presentation. I am of settler background, and I'm joining you from my office in the Department of Physical Therapy on the traditional, ancestral, and unceded territories of the Musqueam people.
And I'll jump in next. My name is Amy Ellis. I am of English, Scottish, and Irish descent, but I was born on the lands of the Sotho and Swana people in South Africa. So this means I am a recent immigrant and settler here in Canada. I am the regional clinical lead for the Fraser Valley cohort of the MPT program. So I am one of the full-time faculty that works to support both teaching and in-class teaching and clinical education in the program. I am joining today on the traditional shared and unceded territory of the Kwakwat, Kwantlen, Katzie, Semiahmoo, Tsawwassen, Kwikwetlem, and Stolo First Nations. And this is also the region that I support of students and communities in the MPT program.
And maybe we will talk about it later as well, but our program does expand across the entirety of the province. And I typically work out of the Vancouver campus, which is on the unceded ancestral territories of Musqueam people. But today I am calling in from my home on the unceded ancestral territories of Musqueam, Squamish, and Tsleil-Waututh nations, which is known generally as Vancouver, but my work does go all across the province to support everyone. Amy, should I hand it back to you to take over?
Yes, I will advance the slide. So I'm going to get us started with a discussion about what is physical therapy. So physical therapists are primary care professionals. So what this means is that patients don't need a referral from another healthcare provider to be able to come and consult and have treatment from a physical therapist. We can work independently. So an example of this might be in an outpatient clinic, or as part of a collaborative healthcare team. And I'll chat a little bit more about what those environments might look like. The goals of physical therapy are to improve and maintain physical mobility and independence, to prevent, manage, and reduce pain, physical limitations or disabilities that may limit activities and participation, and also to improve overall fitness, health, and well-being. So with those like core goals, we can apply this to many different areas of practice. And this, I think, is one of the most exciting things about our profession is that you will get a solid base in all of these areas. And as you move off into your career, you can choose to focus on an area of special interest. And also you can change. So you can start in one area and change to another area later on as your interests and what you enjoy and the communities that you want to work with might change. So orthopedics is anything involving the muscles, bones, and ligaments. And this is probably traditionally what people think of when they think of physical therapy. So it's helping someone who's maybe had a hip replacement. It's working somewhat with someone who's had a broken bone, maybe teaching them how to work again, walk again, how to get them back into activities that they wanted to do before. This would also include sort of back pain, neck pain, and all of those other pieces. Pediatrics, so we do work with children's and teens all the way down to the little tiny neonatal babies in the neonatal ICU. And all of the areas that I'm going to chat about with adults also then applies to the pediatric communities, population. So that would be pediatric neuro, pediatric oncology, cardiorespiratory for pediatrics. So all of that is applied with a pediatric lens because children aren't just small adults. They are a whole special population all on their own. Rheumatology is when you work specifically with joints. Examples of that might be people with rheumatoid arthritis, helping to support them. Gerontology is specifically focusing on older adults and the challenges that they face in their older years. So this would be working with the elders, helping them to maintain their strength and mobility, to help create not just independence, but an ability to help them continue to participate in community activities that they would like to be part of. Pelvic health is a focus on either on function within the pelvic region, so can be related to bladder or bowel control, and that has one certain area that focuses in after labor, both before and after labor and delivery, but it can also be involved with trans healthcare and also surgeries associated with male anatomy as well. Sports physio is also an area that's often well known. So this is supporting either sports teams, can also be school sports people in both preparing for competition and also returning from injury. So manual therapy is a lot of what we do in supporting orthopedic conditions. I mentioned briefly neurosciences, but that is a very broad category of treatment that includes maybe people with strokes, spinal cord injuries, degenerative conditions where their function slowly declines over time. Oncology is specifically working with people that either have cancer or recovering after cancer treatment. But we don't just treat people once they have a condition. We also want to help focus on health promotion and the management of the healthcare system. So healthcare promotion is trying to help prevent people having issues that need other treatments further down the line. And then healthcare management represents that we don't just work in the system, but we can help to support and help to manage healthcare teams and work within the management of the healthcare system to help make the change and support change that is needed. So what are the sort of areas that we work? So in the public sector, you could be in hospitals, and this could be in a variety of types of wards, post-surgery, trauma, ICU, which stands for intensive care unit. That's where I practice when I'm working clinically. This is some of the most sick patients, rehabilitation units, pediatrics, geriatrics, so across the whole lifespan. And then they may also be involved in the maternity units as well. We can be in community health centers, long-term care facilities, and nursing homes. You'll also see that we're involved in home care service, so where we actually come into patients' homes to provide treatment. We might be involved in rehabilitation centers that are focused on working with a certain patient population. So, for example, spinal cord injuries or amputees in that initial period after their injury. And you may also see physios involved in public schools, so helping children with developmental or physical disabilities. In the private sector, you may see private clinics. That's probably one of the more visible aspects of physical therapy. And this can include both in-person help and telehealth, which everyone kind of was forced to jump into during the COVID pandemic, but it has created a revolution that has really helped to improve care for people in rural and remote communities. So that is continuing on. You might see us physios working with sports teams and athletic organization, and then also workplace and occupational health. So looking at how people are functioning in their work environment and also helping with rehabilitating after workplace injuries. So our Masters of Physical Therapy program is as I mentioned, I'll talk a little bit more on the next slide about the program overview, but you can see that we have a large group of students, which is growing as we distribute across the province, and you'll hear a little bit more about that in future slides. But we are the only entry to practice program in BC, so that's why we are distributing to try and meet the needs of our learners in different areas of the province. So it is a 2-year, 26-month full-time professional master's degree. So this means that, and Louis will talk a little bit more about the requirements. In the program, you'll have over 1,000 hours of clinical experience in 5 clinical placements. And that's what I do in my clinical education role, is help to support students in those experiences. We're one of only 15 MPT programs in Canada. And as I mentioned, the only option here in BC that you have an option to study at one of our 4 sites. So we are trying to focus on helping people to live closer to home while studying the program. And we are accredited by the Physiotherapy Education Accreditation Canada, so PIAC, and then that means that you're able to register as a physical therapist once you've completed national examination. You're eligible to do the national exam, and once you've done that, you are able to register as a physical therapist. So this is just a representation of what those 26 months in the program might look like. Every year is structured very similarly. The exact dates will change year to year, but this is sort of an overall view of what the flow of the program looks like. So we start orientation in August. That's when we bring in our new students. The first 2 blocks, so this is taking up most of your first year, is really focused on teaching you the foundations of physical therapy. You're covering a little bit of each of the core areas of practice. So MSK, neuro, and cardiorespiratory. You will have covered the basic information that you need for those areas so that you can go out on your first placement in the April of your first year. So clinical placements are where you go out, you work under a preceptor who is a practicing physical therapist, and you get to actually work with patients alongside your preceptor and practice the skills that you've learned in those first 2 very academically focused blocks. There are 2 opportunities where you get out into clinical environments, one in block A and one block B, that we call shadow placements. And there you just get to follow a physio in a clinical environment for a day and reflect on what you're learning in context of what you saw, and help to create that link between a lot of the theory that you're learning and the realities of clinical practice. We then move into the second year of the program, which you'll see that the shift is a lot more away from that in-class academic work, which does also include practical labs where you learn and get to practice your skills, either with the instructor in the room with you, or if you're at a site that's distributed for that session. Because when I teach from the Fraser, I am distributed to Vancouver, the North, and the island. You will have physios from those communities with you in the lab. So even if the instructor isn't with you, you will actually have another physical therapist that knows what the instructor is teaching to see what you're doing and help you with practicing those skills. So then that second year, you get to spend 4 of those 5 placements, yeah, 4 of the 5 placements out in the community. Placements are stretched across acute and hospital placements, community and rehab placements, and then also the private practice and ambulatory care models. And we want to make sure that students get a good breadth of experience. And typically the program will end sort of mid-October, and that's has just coincided. We've just been working on supporting the end of the program for our current 2025 grads. So that's part of the work that I do, is supporting these final 2 placements. Oh, I jumped forward a little bit too fast. Trying to go back. Oh, I need to go back. It jumped me forward quite far. Sorry. There we go. This is where I should be. So this is an overview of the MPT program and the structure of our curriculum. So what you can see is over the course of the program, there's this shift from foundational core knowledge, increasing in complexity to meet these graduate outcomes for entry to practice general physical therapist. So you need to be competent in all of these core areas of practice to be able to meet the requirements of the degree. You can then, as I said, spend time focusing on your areas of special interest, but we need to make sure that everyone has a good, strong foundation in all of the areas. So what you will see over the course of the program is basic sciences and evidence-informed practice is woven through with the musculoskeletal, neurological, and cardiopulmonary areas of practice. And then within that is also linked in with ethical decision making, professionalism, critical thinking, and communication. So these aren't courses that just happen at discrete times. These are all pieces of content that are woven across the curriculum as it advances towards more complexity and integrating all of these pieces together. We also work across the continuum of care, so from hospitals all the way into community care in people's homes, so in all the different places that we work, and then also across the lifespan, from those little neonatal babies that I spoke to, all the way to our elders. There is also an option to pursue a MPT PhD dual degree. This is offered in partnership with the Rehabilitation Science Graduate Program and the Department of Physical Therapy. And it's designed for candidates who are interested in integrating clinical and research learning. The structure of this is changing a little bit recently, but my current understanding is that you would work on your MPT program and then be supported in your PhD as you're working through. And there is some opportunity to align the work that you're doing in your MPT program with your projects that you need to do as part of your PhD program. And I'm going to hand over to Shannon.
Thanks, Amy. So Amy mentioned that the program is distributed across the program. So this is a bit of a visual for you. You can see that in Vancouver, we have a bit of a dual model cohort going on. We've got 60 students who will be attending to the Vancouver region, and then another 20 students who will study in Vancouver, but do a lot of their clinical placements in the interior. And then 20 students up in Prince George, 20 in Victoria, and then 23 in Surrey, which is our Fraser Valley cohort. So even though these students are in separate geographical regions, they are all connected by video conference in the classroom. So much in the way that we are able to meet together over Zoom, the classrooms all get to connect together via video conference and they can all see each other and see their instructors in different rooms. And then some of the classes are online only, so there's some asynchronous options as well. Um, but otherwise, everyone generally receives the same amount of education with a little bit of changes so that people are receiving curriculum based on the region that they're studying in. I'm gonna go through each of the cohorts in a little bit more detail, specifically for Indigenous students and the resources that they have access to. So in Vancouver, there is the First Nations House of Learning, which is also known as the Longhouse. So lots of different opportunities there, such as there's some undergraduate level tutoring, but sometimes some people feel that it's helpful in terms of like the biology aspects of it. Um, they also have access to counselors. Sometimes there's a nurse on site. Um, and they do just lots of cultural programming, which you have access to. Also, there's now the Chautauquam Collegium, which is located at the Longhouse, and it's another, home away from home for Indigenous students. There's a kitchen in there. Tutoring can also be held there. So lots of different opportunities. You can visit the garden and the Weewa Library. Over at the Indian Residential School and History Dialogue Center, they also host wellness drop-ins. So lots of different opportunities going on all the time. The Vancouver campus also has priority access to housing and childcare for children or for families on campus. So that's just an opportunity to think about if you're applying to the Vancouver cohort. And then over in the north, so up in Prince George, a smaller cohort. Some people say that the smaller cohorts allow them to build a lot closer of a community than they do in Vancouver, which is that big group of 80. And so the aim of the northern cohort is to increase recruitment and retention in northern rural areas. And up at Prince George, they have the First Nations Center and Gathering Place, and they have a garden as well and lots of different resources that you can access there. In Fraser Valley. It's located right near the Surrey Memorial Hospital, as well as the Fraser Region Aboriginal Friendship Center. So because it's um, a much smaller, it's kind of like a satellite campus. So there's not the same amount of student resources at the actual building, but you do have access, all students in any cohort all have access to the UBC resources for Indigenous students. You just have a few less physical resources in the Fraser Valley campus, but you are close to the Friendship Center. And just like the other cohorts, a lot of your clinical placements will be focused on the Fraser Health region.
Great, Shannon. I'm just going to interrupt to say there is a small typo. The northern cohort only has 20 students, not 23 students. And it is the Fraser Valley who will have 23 students starting next September 2026. I just wanted to clear that up. Sorry.
Right, thanks. Victoria is another 20 students. again, a nice small cohort. They aren't at the main UVic campus. However, you can go to the main UVic campus and access their First Peoples House and other Indigenous student supports there. But again, there's all of the same UBC access that you have, and there's lots of virtual programming. As I mentioned, you build some really close connections, especially in those smaller cohorts. So if you want to think about the cohorts in terms of where you would like to spend your time learning in the classroom versus where you want to spend your time out on clinical placements, which could be a good opportunity for you to start to gain practice in areas that you would want to work in the future. And then also balancing that out with what kinds of resources do you have access to. Again, everybody has the same UBC resources. You might just have additional resources based on the location that you're at, such as gaining the access to the Prince George gathering place for Indigenous students and so forth. There We also try to do a lot of virtual connecting. And so we do things as a program as well. I just wanted to mention that some different virtual check-ins and things like that. We've done beating nights, check-ins with elders. So there's lots of ways to connect and can continue that community building. Across UBC, UBC's put a lot of work into supporting Indigenous students, and so most resource teams have Indigenous staff or staff dedicated to Indigenous students. A big resource I want to highlight is the counseling team. So they do have an Indigenous specific mental health and well-being team. We also have a counselor that's embedded within the MPT program. So a counselor who's really familiar with the workings and the stresses that come with being in the MPT program. And all of the counselors across UBC do in-person and virtual appointments. So again, if you're not at Vancouver, you can take a virtual appointment. Enrollment services doesn't do just enrollment. They also do a lot of financial support. So helping you do planning and budgeting, finding scholarships, access to emergency funding. So they also have an Indigenous team and have been a really great resource. The Center for Accessibility also has an Indigenous team, and their purpose is to help folks who have disabilities or have a chronic medical need where they need some accommodations to help them through the program. And then in terms of looking at equity and inclusion and fair treatment, lots of options in Vancouver or across UBC right now. So they have the UBC Equity and Inclusion Office, which also has a human rights advising office. And then within the Faculty of Medicine, there's the Respectful Environments Equity, Diversity, Inclusion team, which has been working with our team and working with our efforts towards more equity and inclusion across the program. And then, so once you get through the program, the opportunities for MPT graduates are vast. There is so many opportunities for continued education. Amy earlier mentioned how flexible the areas that you can work in. And so you might specialize in one area and then want to do more continuing education, specialize in a different area. You can work in a lot of different places. So there's a lot of flexibility in terms of where you work, what kind of things you specialize in, like the actual schedule that you get to work. And there's tons and tons of job opportunities. Physical therapy is one of those careers that's highly in demand, which is why our program continues to expand. So something for you to just ponder on is what kind of interest that you have in the profession and our program. We'd be happy to explore that more with you. We're hoping to plan a Q&A session later in the year, but feel free to always email us as well. Louis, can I pass it over to you?
Yeah, thanks, Shannon. Great. So I'm just going to go over some of our admissions requirements. This is a bit of a shorter, condensed version of our typical presentation on admissions requirements. if you want more details, we do have recordings of our other info sessions that you are free to check out on our website. And we're also going to be hosting a Q&A specifically for the Indigenous Pathway later on in November. So you can keep an eye out for that. It hasn't been announced yet, but we'll add that to our events page along with our other recordings pretty soon. So in terms of requirements, you need a 4-year bachelor's degree in any field. It could be in arts, engineering, business, anything. And it does need to be from an accredited university. You also need an overall average of 76% in your senior level courses. So senior level courses usually means 300 level or above, or sometimes the course codes are a little bit different, but essentially 3rd-year courses or above. You also need a minimum of 72% for all of your prerequisite courses. So those prerequisites are physiology, anatomy, statistics, psychology, English, and physics. You'll need 70 hours of volunteer experience with people that have cognitive or physical disabilities, and you'll have to complete the CASPER test. For those who are not familiar with the CASPER test, it is a situational judgment test that is both done online through video format as well as written answers. It is not a UBC test, it's a third-party test. So if ever you have any questions about CASPER, we highly recommend that you go on their website and look at the information that they have there, because they have a bunch of information on how to prepare, what it's for, how long the test lasts, and all of those things, as well as test dates, because there are specific test dates for you to sign up for. You'll also need to provide 1 academic reference and 1 practical reference. And when you're submitting your practical reference, it should be the person that supervised you during those 70 hours of volunteer experience. Okay. We also have a minimum of 6% of our seats that are reserved for Indigenous students. So that translates to roughly 8 seats in total. So as I just mentioned, this is a goal, not a minimum or a maximum. To be eligible for these seats, you need to meet the minimum requirements that I just described. And you also need to provide some documentation about your Indigenous ancestry. So we do have a list on our websites of all the different types of ancestries that documents that we accept. But if you have any questions about those, you're free. You can email Shannon at shannon.field@ubc.ca, and she can answer your questions regarding those documents. For the interviews, we use the MMI format, so multiple mini interviews. This is to ascertain your communication skills, your professionalism, and problem solving. We usually do 10 stations. One of them is a break station, so you'll have 9 different questions or scenarios. You have 2 minutes to read the scenario, and then 6 minutes to answer with the live interviewer, and all of this is done online. For folks applying to the Indigenous Pathway, we do have a MMI skills workshop that's offered in February. And it'll basically help you practice the MMI format. So that format that I just mentioned of answering questions in that very condensed time frame. So, a lot of successful applicants have reported that practicing that format has helped them decrease stress and overall just have a better time with the MMI. And also it's a good time because we do invite Indigenous students and staff and faculty to join us for that workshop. So it's a good time to connect with them as well. Important dates to remember, so our applications opened on October 1st. They will close on January 5, and the document deadline will be on January 15th. So the only thing you need to submit by January 5 is your online application. That includes all of your academic information, your reference contact information, and all of the other questions that we ask on that form, which includes site preferences and things like that. So you submit your online application on January 5, and then after that, you have an additional 10 days to submit everything else. So your supplemental application, and then your references, who are sort of requested to provide their references once you submit your online application. They have that additional 10 days to submit their references, and all of the other documentation. So that's all due on January 15th. And our MMI are usually during the first week of March. This year, we already know when the MMIs will be. It'll be on March 6th, Friday. So if you intend to apply, please put that in your calendar as it's been confirmed. And for the last slide, I'll hand it over to Shannon.
Thanks, Louis. So yeah, financial support and opportunities are a big interest to a lot of students. And so, as I mentioned, Enrollment Services provides a lot of really great resources. They do workshops, they do one-on-one advising, they can help with tuition payments and scholarships, and they know about student loans and all sorts of really awesome resources, including they can offer some emergency funding. We also try to keep track of scholarships that are out there and provide information to each of you. I try to, there's a general season that scholarships kind of come out in the spring and then out in the fall. And so in the spring, I try to send that list out to everyone that has applied so that you're aware of all of the scholarships and awards that are available to Indigenous students. I encourage you to apply for those awards right away. It doesn't matter if you know whether or not you're in the program yet. The funders will confirm that once they're ready to provide their funding and they've made their decisions. You can also get sponsorship from your band, Métis or Inuit organizations. It's something to check out on. And don't just apply for awards that are for Indigenous students only, apply for all of the awards. There's lots of funds out there available. So I just encourage you to access all of them, as many as you can. Yeah. So I think that concludes our workshops. Again, don't hesitate to get in touch with us. You can email us. As Louis mentioned, we're also hoping to do a Q&A session next month, so stay tuned for that. And we look forward to hearing from you.
Great. Thanks, everyone.